Well, Dr. Tony, it's such a joy to be here and to see you in person. Your reputation precedes you, really. I hear about a lot of good reviews about Hope4Cancer, and also many clips about happy patients recovering from really desperate situation, and really interested in finding out your practice and what is really happening here. So, Dr. Tony, I'd like to start out by asking what kind of a medical license you have, and also how long have you been practicing medicine?
Well, thank you for this opportunity, Jay. It's always nice to share what we do at Hope4Cancer treatment centers here in Mexico. I have a medical degree, MD degree, from the Autonomous University of Guadalajara here in Mexico, a university that has been around for many, many years, one of the most prestigious medical centers in Mexico, and that was in 1988 when I graduated medical school. And in Mexico, like in every part of the world, or most part of the world, you do 4 years of medical school, then you do a year of internship, but then you do, in Mexico, 1 more year, and that's called social service. When you're kind of in the boony, when it's like the doctor, the priest, and the mayor, and you have to solve everything. So that's a really intensive 1 year where you're embedded in a community and you're just serving, right? And we don't have x-rays, we don't have MRIs or CAT scans, very few labs. So we learn how to be clinicians, right? Without having to resource to so many diagnostic tools. And early on in training, that's good. Obviously, after that, then you go to centers, and here at Hope4Cancer, where we have sophisticated diagnostic tools. And then I got a naturopathic degree, an ND degree, and in Trinity College of Natural Medicine in the U.S. So I'm an MD, ND. My medical license is in Mexico, and also I'm medically licensed in Spain, in Europe. So that's a short history.
Well, sounds like you're very well qualified. And my next question will be, what kind of patients are under your care, and what is your main interest in your field of medicine?
Right. So being the founder and chief medical director of Hope4Cancer treatment centers, where we have 2 centers in Mexico, 1 center in Colombia, South America, and another center in Asia, our focus is cancer. But remember, when we talk about cancer, we're really talking about the foundations of treatment, which we call 7 key principles, and that's really also prevention. Because as we treat cancer, we're also learning and teaching the companions of patients how to prevent, how to decrease the risk of getting cancer. And one of the things that we do here, and we're doing together now, is education. Right, because 92% of the patients at Hope4Cancer are stage 4. So they come here when they've done everything conventional medicine has to offer: chemo, radiation, surgery, immunotherapy, hormone therapy, or a combination of all those. Or they've been told, you know, you're just diagnosed with stage 4, it's so advanced, for your type of cancer, we really don't have a solution. So those are the majority, the high majority of patients that come to us. And one of the things we want to see as the years go by is patients come to Hope4Cancer in earlier stages. Right. So that's our challenge, and we're good at what we do.
That's good. That's good. As the name suggests, Hope4Cancer, there's still hope for these cancer patients.
Yes, exactly. And
that's great.
Yes, and the core principles here at Hope4Cancer is hope, faith, love, and generosity. And our experience with those core principles is so powerful in the sense that it comes out of all the staff members. Whether it's the cleaning person or the doctor, the nurse, the therapist, the nutritionist, the chef, the greeters, you know, the missions team, these core principles are embedded in their nature and their philosophy of what's really important to treat a cancer patient.
I hear from some patients how this place is like a home. They are treated like they're treated at home.
Yes, because
very welcome.
Yeah, I tell patients that once you come to Hope4Cancer, you're part of the family. Right?
Wow.
You're part of our home, and it's not just about the time that you spent at the clinic, at the treatment centers. It's also what happens when you leave, and this is very important because patients are only here 3, 4, 5 weeks. What happens when they're home? So our home program support staff is a big part of our success, and then patients come back. They come back initially every 3 months so we can monitor them. We can make tweaks or adjustments to their home program, and this is the formula that works, and it gives the patient that confidence and that sense of security that we're with them. It is a family. There is love. There is hope. There is generosity, and there is faith.
I definitely felt that when I visited your clinic, and I feel like many of the patients who probably don't want to go back after 3 weeks here. So, Dr. Tony, how is Hope4Cancer different from other clinics in treatment options and also patient care? And what are your reasons and explanations in employing alternative medicine in cancer treatment?
Yeah, that's a really good loaded question, Jay.
Yes.
And the first difference is our philosophy. Our treatment philosophy at Hope4Cancer is based on the 7 key principles. And we'll explain that regarding treating the person with the cancer, not the cancer in the person. And when you do this, you're treating the reasons, the characteristics, the hallmarks of why the cancer developed. Because cancer is a manifestation of a process, of a dysfunction, of a lack of homeostasis that can be happening for 5, 10, 15 years. So it's hard to think about cancer as something good for the person, right? It's hard to envision that. But I hear that all the time. Patients say, cancer was the best thing that happened to me because it saved my life from a disaster that my life was heading to, right? So cancer is a wake-up call, and it's a strong wake-up call, never to be underestimated, of course. And so at Hope4Cancer treatment centers, we're different in how we see cancer. We don't see it as removing the tumor or giving radiation to burn the tumor or giving chemotherapy to shrink this tumor. We can use those options very selectively and at the right time if and when necessary. However, the goal is to go deeper, go to the cell level. I know you like that word, going to the cell level and then working your way up. Fixing the cell that then will translate to better tissue function, organ function, the systems, the digestive system, the nervous system, the endocrine system, the immune system start working better, right? Because you're at the cell level. Another big difference at Hope4Cancer is our follow-up program. When the patients leave the treatment centers, we have a home program support staff that continues to monitor the patient, to communicate with the patient, to interact with them, and if their physician is willing to back home, we also have a direct communication with the physician. And the patient comes back every so often, periodically, to get a checkup and then to adjust the treatment. So, once you our patient at Hope4Cancer, we're married, right? And and we're there, committed, and serving the patients. So what we want also to know is that at Hope4Cancer treatment centers, faith is a big part of our philosophy. Outcomes are another big difference at Hope4Cancer. We have an R&D team, research and development team, who has focused on doing 5 years survival statistics. And this is a retrospective study. We're now entering the 5th year data. So at the 4-year data, we were able to track a significant number of patients with pancreatic, prostate, breast, colon cancer, lung cancer, and a few other cancers for 4 years so far. And when we compare their 4-year survival with the National Cancer Institute, NCI, SEER data, this is the cream of the cream of the crop. This is surveillance, epidemiology, and end-stage result data. We are at least 3 times better in 4-year survival than they are.
Wow.
And so now we're going to have our 5-year data, shortly. And that's not the only thing. Not only are patients having significant survival, but the quality of life is important. Because as we treat holistically, one of the differences at Hope4Cancer is that you will have significant improvement in quality of life.
Wow. Well, that was a loaded answer to a loaded question. Definitely, some of the words that you said is really ringing in my heart, that this is your mission, this is your passion, this is more than what you do. It seems like this is your life.
Yes.
And this is definitely your walk with Jesus.
Amen.
Yeah. To get this kind of care from a clinic it's really rare. Because I know a lot of patients come to clinics that like run the mill, they get treatments and leave, but to have that kind of profound and a good follow-up program, really caring the cancer patients themselves, the person with cancer, is what really touched me. But let's move on to our next question.
Thank you.
Yeah. Hope4Cancer is famous for its 7 key principles that's incorporated into patient care. And why are the 7 key principles essential for patient care at Hope4Cancer?
The reason why is rooted in my many years of experience treating cancer patients, and as I said previously, mostly advanced stage 4 cancer patients, and not only at Hope4Cancer treatment centers, but throughout the world. I've been blessed that I've been to over 70 countries, and I've seen patients in many different situations. And throughout these years, I've come up with the 7 key principles of cancer therapy that really treat and focus on the hallmarks, the characteristics of cancer that was actually developed in the early 2000s and then further studied in 2011 by Hanahan and Weinberg. These are research scientists out of the Northeast in the U.S., and they elucidated the 10 hallmarks or characteristics of cancer, such as cancer being able to make their own blood supply so that they could get nutrients easier and eliminate waste. Cancer cells sending their own growth signals independently of the body and suppressing anti-growth signals from the body. Cancer cells as an inflammatory disease, right? Cancer cells' ability to mutate and shield themselves from being seen by the immune system. So once we know that, and then I put all this together with my experience with thousands of patients, and that's when I came up with the 7 key principles to cancer therapy. 6 of those principles are also for prevention. So I can quickly go over them. The first key principle is non-toxic cancer therapies. And this is where we focus, as the word says, in providing therapies that are not going to harm normal healthy cells. On the contrary, it's going to fortify them, it's going to nourish them better, it's going to oxygenate them better, it's going to provide better cell signaling and communication through calcium ions, right? And so Non-toxic cancer therapies, we're looking at P53 gene expression. We're looking at these growth signals of cancer cells and so forth. So very important. If we take as a premise, which we do, is first do no harm.
That's right.
Right? Very important. The second key principle is oxygenation. Well studied that cancer cells thrive on low oxygen or hypoxia. Third key principle is detoxification. We know that heavy metal toxicity, toxicity from electromagnetic radiation, food toxicity with pesticides and so forth. So we have to detoxify on all levels. And the biggest level of detoxification, in my experience, is the thoughts. And I typically say, and I've been quoted as saying this many times, is a negative thought can kill you faster than a bad germ. Right?
Yes.
So we have to detoxify those negative thoughts. We have to have a positive attitude. We have to be in healthy relationships and healthy relationships, even with friendships, right?
Yes.
And so that's very important. The next key principle, which is the fourth one, is the gut microbiome.
Yes.
Right? 75% of the immune system is in the gut. If we could increase gut health by decreasing acidity, for example, decreasing lactic acid load, and having more alkalinity in that gut and in that tumor microenvironment, then we're able to have better gut health. And then that leads to the next key principle, number 5, which is immune system, upregulating the immune system, right? And so if we have better gut health, less acidity, and we're focusing on different pathways of immune cells like macrophages, cytotoxic T lymphocytes, natural killer cells, P53 gene expression, all these things, then our immune system is going to be upregulated. Number 6 is nutrition.
Yes.
And
Important.
nutrition, right, the foundation, one of the foundations of health, making healthy nutritional choices key to a patient recovering or preventing, decreasing the risk of developing cancer.
Okay.
And the 7th key principle, which might be and is the most important one, is the emotional spiritual.
Yeah.
Right? Because I believe from many years of experience that cancer begins on that level, the emotional spiritual. And as believers, we know that there are attacks on a constant basis, and we need to be in prayer. We need to be in likeness of Jesus and detoxing of these negative emotions and strengthening our spiritual life is key.
Yes.
So it's about the spirit, the soul, the mental, emotional, and then the body. So that's the 7 key principles in a nutshell. Very important that these all work together, right? All work together. And by doing this, then we're addressing those hallmarks of cancer, the things that conventional medicine, and this is a big difference with what we do, conventional medicine doesn't talk about any of this, right?
Well, sounds like you cover all the bases.
Yes.
Wow, sounds like a full spectrum treatment. Well, my next question is, considering that the majority of patients have been under conventional cancer treatment prior to their admission to Hope4Cancer, how do patients respond to the use of alternative medicine and its outcomes?
So, first of all, we want patients that come to Hope4Cancer treatment centers to want to be here. Right? Because sometimes they're pressured by family, right? The spouse, the daughter, the son, oh, don't go into alternative medicine, right?
I see.
However, most of them, 92% of them, have already done conventional medicine.
Okay.
And then they have to deal with that fear factor.
Yeah.
That even their oncologist, who knows that the treatment is not effective, they say, well, let's do this clinical trial. let's do more chemo, let's change the chemo.
Yeah.
But the more chemo that the patient has had, the more resistant that cancer is, the more side effects, the more toxicity. So our outcomes are quite significant in the sense that even though we're dealing with stage 4 cancer patients who have had a lot of toxicity and aggressive therapies and have not had the results that they want. Some of them may have had partial results for some time, but then the relapse, right, the recurrence is when we see these patients. So we are just blessed, Jay, to have the results we have following the 7 key principles. 70% of our stage 4 cancer patients live at least 5 times past the expected prognosis.
Wow.
What that means is when they came here, they were expected, let's say, to live a month, 3 months, weeks sometime. They're living at least 5 times that with good quality of life. And as I mentioned earlier, when we looked at the 4-year survival data compared to the National Cancer Institute, is at least 3 times higher. And now what we're doing is we're doing longitudinal studies because according to conventional medicine, and when they approve a drug for cancer, chemotherapy, for example, or an immunotherapy, all they have to show is that the patients are living 3 to 6 months longer, and then the drug is approved. That's not Dr. Tony saying it. That's what a medical director at a major institution in the U.S. told me. He said, Dr. Tony, just do a longitudinal study.
Wow.
Right? So we, of course, are going to do that because that's what conventional medicine wants to see. But it's more about living 3 to 6 months longer, right?
Of course.
Yes.
So the results generated here it far surpasses what is expected out there.
Yes.
That's great. That's good to hear. So my question is now, how did you learn about SAC therapy? And could you elaborate on that?
Yes. So I was blessed July of 2019 July 2018.
Okay. Yes.
I was in Asia, and I was in a place in Singapore. We were filming a documentary series for the truth about cancer for Eastern medicine, and I met a guy named Jay Lee, and he was giving a lecture on SAC therapy, and so I talked to my friend Ty Bollinger, the producer of The Truth About Cancer, and I said, hey, this is pretty interesting. Why don't we also interview Jay Lee for this? And after listening to you, Jay gives this brilliant talk, lecture, showing clinical data, showing so many published studies on the multiple benefits of SAC therapy, not only for cancer, but Parkinson's, neurological diseases, heart health, and basically cell health. Then I was convinced that not only did this have to appear on The Truth About Cancer Eastern Medicine edition, but we needed to incorporate SAC therapy at Hope4Cancer. So since July of 2018, this is when we started researching. I had my chief science officer and my executive team look into SAC therapy. We were convinced from a medical perspective. Then we sent that to the business administrative section of Hope4Cancer. We worked out the finances, and we have been using SAC therapy since then.
That's great. That's great. So how did you incorporate SAC into your practice and the possible treatment protocols? You do have many protocols here, but how did you incorporate SAC? And if you could share some positive outcomes and experiences with SAC.
Yes. Incorporating it was so easy. Why? Because it's non-toxic, which is one of our premise. 2, it's well tolerated. something we want. We want compliance. 3 is that it synergistic. It works with any therapy that we do. And so even if a patient has received chemotherapy, more the reason why, because a lot of patients when they come here, they're just getting off of chemo or radiation, so this is perfect timing to add SAC therapy at this time. And then incorporating it was easy also because we want our therapies not only to be given at the clinic, but enable the patients to continue that at home. And with SAC, we're able to do that. So we administer it intravenously at the clinic and orally. And when the patient goes home, then they continue it orally for an extended period of time, typically 3 months, and then they come back for our follow-up, and we adjust and tweak the home program. So the incorporation part was easy. It's well embraced by our doctors. We have many doctors in our clinic, so as Chief Medical Officer, I had to do my due diligence with our Chief Science Officer and then bring this to the doctors. They had to learn about it, accept it as part of the therapy, which they embrace. Some of them are even recommending it to their family members or taking it themselves, which is a big vote of confidence, right, for our patients. That if the doctors are taking the product themselves or giving it to their loved ones, there's a good sense of security for patients that, hey, this is good for me. And so this, all these factors, the synergistic effect, the compliance, the well-tolerated, the no contraindication with other therapies has been easy to incorporate, and then that has reflected in our patient outcomes. Because for this time that we've been using SAC therapy, the observation is that it has improved our patient outcome. As you know, Jay, sometimes it's tough to see how much or exactly, because we're doing a multiple treatment approach, right? But this is a key product embedded in the Hope4Cancer treatment protocol. And so thereby, I look forward to seeing outcomes as we collect data, right, with our R&D team, and seeing the ongoing rise in treatment outcomes.
Well, that's definitely encouraging to hear that the overall outcome by adding SAC has helped.
Yes.
The calcium homeostasis not only affects physiological aspect of health, but it also, and we believe that it really improves emotional health as well. So please share with us if you have seen the differences in your patients' spiritual and emotional health with SAC treatment.
With respect to emotional health, what I did is I asked my best practitioners at Hope4Cancer treatment centers. They work on the behavioral, emotional, and spiritual therapy. So these are medical doctors that are focused on working on the emotional aspect of disease.
Okay.
What is the correlation with breast cancer and a loss of a child, or an abusive husband, or a loss of a job? See, so we look at all these traumas and conflicts, and we look for the association with the cancer. Breast cancer, prostate cancer, colon cancer, lung cancer, ovarian cancer, whatever cancer is. There's always a correlation with emotional, traumatic shock experiences and the location of the cancer. So that being said, we at Hope4Cancer know and have plenty of experience that the emotional aspect of recovering from cancer is very important.
Okay.
What the SAC therapy has allowed us to observe is that when the best practitioners are engaging with patients on the emotional aspects of cancer, they're less irritable, These patients have better cognitive function, so they're able to recall these traumatic events. It's like if you have your laptop and you know there's a file there, but you can't quite find that file, right? So all these traumas and conflicts are here, but sometimes to bring them out and to express them with our best practitioner that allows you to let go of that trauma is not very easy. And when we have the SAC therapy and we're having that cell-to-cell communication, better signaling, better enzymatic function, the pathways functioning physiologically, then the patients are able to remember these traumas. They're able to remember these conflicts, right? And so it makes it a lot easier for the practitioner to help the patient, right? So we're getting that aspect of it. Also, what the best practitioners are telling me is that inevitably the patients seem and are more energetic.
I see.
So if they're more energetic, then they're going to follow the therapies better. They're going to be more engaged emotionally and mentally. They're more at peace, more calm, right? And they're going to do what they need to do with joy and peace. So at the end, this reflects better patient outcome. Right? So definitely the SAC therapy has a significant emotional contribution in our therapies, and I would encourage any physician that is watching this to understand that it's not just on the physical, physiological level, it's also on the emotional, mental, because we are one. We can't separate the physical body from the emotional, spiritual body. Right? And so benefit in the physical is going to benefit the emotional, spiritual, and vice versa. And that's what we are getting with SAC therapy.
That's very encouraging to find out that both physiological and at emotional level, SAC therapy is helping.
Yes. And as a physician, you know, sometimes you say, well, how is this possible? But sometimes we don't understand all the science of how this works on that emotional level. But when you observe it time after time, one of our physicians, who is a best practitioner, observed it with her mom and her father. Right? So, I mean, she experienced it firsthand in that sense with her loved ones. So there, it's not a matter of, hey, prove this. It's happening.
I guess if you become healthier from cellular level all the way up,
that's right.
Definitely going to affect your mood and emotions as well.
Excellent.
Okay, great. Calcium and Bone Health Institute, we're based out of Canada. We're founded in 2001. And we're a predominantly scientific and research-based institute. We're dedicated in finding out the effect of SHC and on its effect on bone health as well as other degenerative diseases. And our primary purpose is to research and to study the roles of physiological action of calcium in our body. And we are interested in finding out how CBHI can help your clinic. What would you like us to bring to your practice so that we can be of more help?
Well, I like this. One of the things, being an integrative oncologist and working in so-called alternative or holistic or complementary therapy is what you do, what we do, science-based.
Yes.
And one of the things that I tell patients and I teach around the world is that all the therapies at Hope4Cancer are science-based.
Yes.
There's research, there's publications, or clinical studies, clinical trials in some of them. So the Calcium Bone Health Institute, what they could bring to Hope4Cancer is that the science, the research, the technical aspects behind or embedded in the action of SAC therapy. Because then we have a way to show the patient, besides anecdotal information, which is very important, patient outcome, but here it is. The CBHI has provided this information to us, very important. And I know that cell health is where it starts and it stops. And so providing hard data, providing facts, animal studies, human studies, all this is just icing on the cake as a clinician, because we're focused on patients, right? We can't do what the CBHI, the Calcium Bone Health Institute, can focus on, which is scientific research and studies. So I think it's a perfect marriage of a clinical aspect in what we do, and then bringing in the lab, the research component, and marrying it together. So I'm really appreciative of that information, that research-based scientific data that we can receive.
That's great. CBHI had done some animal studies with really great positive results, and then also had opportunity to measure so many patients' bone density results before and after, and we're able to compile that data, as well as our research team is also working together with some universities around the world to set up a human clinical trial. So all of that is coming, and we're excited about that as well.
Another point here, Jay, is that typically we say that the skin is the biggest organ in our body, and what about the bones, right?
That's right.
The bones are not just bones that are helping the structure of the body. The bone, it's an organ also.
That's right.
Right?
Yes.
And so bone density is so vital to the physiology, the emotional component of our health, and decreasing the risk of cancer and chronic disease. So focusing on bone density, focusing on calcium as the main signaling molecule, main cell-to-cell communication pathway in the body, it's where it starts. And so I really appreciate the work of CBHI.
Thank you. Thank you. Really, how our skeleton is made out of calcium as well, and then there's calcium metabolism that regulates the precise concentration of calcium ion intracellularly and extracellularly and in the blood serum. There's no other nutrient or the mineral that is so precisely regulated. That's how important calcium is and its effect in all levels of physiological function. So we'll definitely, we're privileged to work with Hope4Cancer, getting involved in your R&D as well, to come up with the hard data that can put out in the world to see the real effects of what calcium ion can do for cancer. Lastly, CBHI is really planning, as there are more interests out there in the world from practitioners, that we put together SAC and bone health education program that could provide the needed information and training for practitioners to correctly prescribe SAC therapy. If we come up with that program, would you be interested in partaking in that training program for some of your staff members here, so that it could help your patients here?
Absolutely. One of the things that's very important for Hope4Cancer is continuing education.
Yes.
And continuing education doesn't just mean, the conventional medical publications, which are skewed sometimes, oftentimes. So having an independent research institute like CBHI and participating in training programs, our doctors are always, looking for additional training, additional education platforms, people that are doing work from a truly integrative, holistic approach is very important. So not only myself as Chief Medical Officer, but I'm sure as Chief Science Officer, and our multiple number of doctors that are medical doctors that are part of our Hope4Cancer physician group will very delighted to partake in this training.
Wonderful to hear that. Well, thank you, Dr. Tony, for your time and agreeing to this interview. I've been truly blessed to come and see how Hope4Cancer operates, and that somehow the SHC therapy is also helping your patients here, and looking forward to working with you years down the road, so that we can both, by working together, come up with improvements to what we're already doing.
Yes.
To help more patients.
Yes. Amen. Thank you.
Thank you.
Thank you so much. Blessings.